Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. GP Online is the official media partner for the RCGP annual conference, and this is our third and final special episode from the event in Liverpool this week. Coming up in this episode, I'll be looking at what Health and Social Care Secretary Wes Streeting had to say in his speech to the conference this morning, when he spoke about the challenges the government faced in rebuilding the NHS and general practice's role in that, called on the profession to step back from collective action and took questions from delegates. I'm talking to Professor Margaret Ikpoh, the RCGP's Vice Chair for Professional Development and Standards, and Dr Steve Mowle, the college's Treasurer, about their views on what he had to say, as well as what they're talking about in their own presentation at the end of the conference today. And we also hear from delegates about what they thought about what Wes Streeting had to say. Later on, I'm speaking to the RCGP First5 Chair, Dr Toyosi Adeniji, about some of the key issues facing newly qualified GPs, and to Emma Walker, the Health Information Manager at CoopaFeel, about the charity's work on breast cancer awareness and some of the resources they have to support GPs and other healthcare professionals. These special episodes of Talking General Practice at the RCGP annual conference have been supported by CoopaFeel. CoopaFeel are the UK's only youth-focused breast cancer awareness charity, and they're on a mission to get every 18 to 24-year-old checking their chest. CoopaFeel educates people on the signs of breast cancer and encourages them to check their chests monthly, so that if they notice something unusual for them, they are empowered to contact their GP and advocate for themselves. CoopaFeel also provides resources and e-learning to healthcare professionals to support them in encouraging breast awareness with their patients. For more information, visit CoopaFeel.org. The first session of the day this morning featured a keynote address from the Health and Social Care Secretary Wes Streeting, who also took questions from the audience. In his speech, Streeting spoke about the current state of the NHS and the challenges facing general practice, and the fact it would take what he called a team effort to turn the health service around and ensure it was fit for the future. He also spoke about continuity of care, the 10-year plan and its aim to move the NHS from hospital to community, analogue to digital and sickness to prevention, and said general practice was key to each of those aims. Streeting used the speech to launch a red tape challenge to bulldoze bureaucracy, as he put it, in general practice, and more controversially called on GPs to step back from collective action, saying it would only punish patients. He also said the government would legislate to finally set up a single register for GPs and specialists, something that GPs have called for many years now. And he talked about some of the tricky issues the profession would have to work in partnership with the government to address, including data sharing and advances in genomics to ensure the NHS becomes a world leader in healthcare research. This is what he had to say about cutting red tape, the single register and collective action.
When I spend time shadowing GPs, one of the things they've been dying to show me is the sheer amount of paperwork you are required to fill in to refer a patient. I was genuinely stunned to hear about one practice that has to complete more than 150 different forms to refer patients into secondary care services. Practices spend as much as 20% of their time on admin and work created by poor communications with secondary care. This is intolerable. That time should be spent with patients. That's why today I can announce that Amanda Pritchard and I will launch a red tape challenge to bulldoze bureaucracy so GPs are freed up to deliver more appointments. That challenge will be led by Claire Fuller and Stella Vig, primary and secondary care leaders who have their bulldozers at the ready. Tell them what's working, but more importantly, what needs to change. We will listen, act, and solve this problem together. Amanda and I will receive the conclusion of this work in the new year, and NHS England will hold ICBs and trusts to account if they fail to act. The other frustration I hear from staff and patients alike are the pointless appointments you're forced to hold and patients are forced to attend. You didn't go through 5 years of medical school plus 5 years of training to tick boxes. So where there are appointments that can be cut out, with patients seen by specialists faster and GPs' time freed up to do what only GPs can do, we will act. Starting in November, 111 Online, which is available through the NHS app, will pilot directly referring women with a worrying lump to a breast clinic. That means faster diagnosis for cancer patients and more GP appointments freed up. Better for patients and better for GPs. And I suspect there are other cases that come across your desks every week where a patient has been passed to you by someone else in the NHS to refer them on to someone else in the NHS too. It is a waste of everyone's time, including yours. And where you give us examples of patient pathways that can be simplified through appropriate patient self-referral or direct referral by other NHS services to save your time, we will act. And it's not just that I value your time, I respect your profession and your expertise. General practice is a specialism. That's why I'm committed to the creation of a single register of GPs and specialist doctors, and this government will legislate to give the GMC the power to do it. It's symbolic, but it's also meaningful. It reflects the partnership I want to build with this profession. What I need from you in return is goodwill and the same team spirit. When the BMA's GPC returned their ballot result on collective action, I wasn't remotely surprised. I know that after years of rising pressures, declining resources, and a worsening service for patients, you feel it's your duty to sound the alarm. And trust me, you weren't the only ones who wanted to punish the previous government. But the Conservatives got the kicking they well and truly deserved on the 4th of July. Capping appointments now will only punish patients and make the road to recovery steeper. So be in no doubt, it is shutting the door on patients. Their care will suffer, receptionists will bear the brunt of their frustration, and the rest of the NHS will be left to pick up the pieces. Worse still, our collective job will be made harder. Collective action really means collective failure. Your message has been received, not from this one vote, but from all the time I've spent in general practice in the past 3 years, literally looking over GP's shoulders and seeing what you deal with and the state of the crisis for myself. There's a reason that back in July, I rejected the list of hospitals suggested for me to visit on my first visit as Secretary of State and went instead to Dr Ellie Cannon's Abbey Medical Centre in North London. I wanted to send a message that I understand how bad things are and that I'm determined to fix them. But I can't do this alone. We can only do this together. So I'm asking GPs to stand down collective action and instead work with this new government that is serious about working with you to rebuild our NHS together.
In response to questions from the audience, Wes Streeting also said that the £82 million of extra funding that has been added to the additional roles reimbursement scheme to employ GPs would continue after March 2025, and spoke about funding for the NHS more generally and the trade-offs that might be needed if we're serious about addressing some of the causes of ill health. He also reiterated the government's commitment to deliver a shift from hospitals to primary care, confirmed his support for the partnership model, and spoke about the contribution of doctors and staff who come to work in the NHS from other countries, but he stopped short of offering any answer to the challenges international medical graduates face with visas after they complete GP training, saying it was a matter for the Home Office. We've put the full text of Wes Streeting's speech to the conference on our website, so we'll put a link to that in the notes for this episode. GP Online senior news reporter Kimberly Hackett went out to speak to some of the delegates at the RCGP annual conference to find out what they thought about what Wes Streeting had to say. Here are some of their thoughts.
Hello, my name is Badria. I'm a GP in Warrington.
And what are your thoughts on Wes Streeting's speech today?
To be honest, I felt a bit hopeful after his speech, particularly what he said about the fellowship scheme coming back. So hopefully I am newly qualified, I've just qualified in the last 3 months, so maybe there is hope for newly qualified GPs. I think this government has a lot of new plans, a lot of ambition, but hopefully we'll see this in action.
And how do you feel about his comments on the visa issues for international medical graduates?
I mean, being an international medical graduate myself, I felt we wanted to hear more about this issue. He mentioned that this is for the Home Office to answer, not to him, but I would have wanted to hear how he feels about it. It's good to hear that he appreciates international medical graduates. It would be appreciated if international medical doctors knew that at the end of their training they could get indefinite leave to remain. That would be really good.
So I'm David Greenwell, a GP in Devon. He said all the right things to encourage GPs that things could improve without making any promises. There was no new money and no promises about number of GPs. but he did say the things that made us think that things could improve. Obviously, he would like GPs to stop their collective action. That would hardly be a surprise. But I think it's going to take a little bit more to convince GPs across the country that things have improved enough that they can actually stop the collective action. I think most GPs still think that the government needs to be pressurised to do more. I think I've been a GP for over 30 years now, and I've heard so many promises about shift to primary care, shifts of investment into GP surgeries, and every single time the pressures of the hospital, the power that the hospitals have, trumps that desire. So no, I don't really think it will, but I hope I'm wrong.
And today, Wes announced that the funding for GPs under the R scheme will continue. How do you feel about that?
So that is an encouragement. The only thing that I think is worrying most people is that the amount of money for each PCN may not be enough to attract GPs to actually do the jobs. The amount of money per session is significantly lower than most practices are already paying. So in areas that are particularly underdoctored, like the southwest of England, I'm not sure that we're going to have enough money to attract GPs from where there are too many.
Hello, I'm Ian Hutchison. I'm a GPST3 in Leeds.
Okay, so what were your thoughts on Wes Streeting's speech today?
I thought it was really good, very positive. I think he gave a lot of encouraging answers. I like the whole idea of not having sticking plaster politics, as he put it, and short-term answers to difficult problems, and the idea of looking at a long-term goal. He certainly seems to have a view that a lot more things should be in primary care and community-based rather than secondary care, and the idea of prevention rather than cure, and I think all of those ideas were really positive.
And what do you think about the guaranteed funding for GPs under the ARRS scheme?
Yeah, I think that's really important. I think that was one of the most important things that I was listening out for, being a final year trainee and finishing training next year. I have a lot of friends that have finished recently and struggled to get jobs, and that's been a real issue and worry for them. I also have friends who are from abroad and done their training here, and they're newly qualified and worried about visas. It was encouraging that although he didn't give a clear answer on that he did see the merit in extending doctors' visas. I think that's super important. It was also encouraging that the fellowships for newly qualified GPs was mentioned as well. I think we really need to push to make the UK a good place for new GPs and make it as enticing as possible, because there's good offers elsewhere and around the world where we can have good qualities of life, and attracting good quality GPs to stay here.
And do you feel more positive for general practice under the new Labour government?
Yeah, I think so. Yeah, I do. I really liked a lot of the answers he gave, and I think the general gist of things was really positive. I still think that it's a difficult place to work at times, and I think there's a lot of issues. And I know a lot of doctors have worked abroad and had really good experiences there. I like the whole gist and the direction he was pushing in. On a personal level, I've worked in New Zealand before. Whether the changes are enough to entice me to stay over the next 3, 4, 5 years or go and seek a career there, probably not.
I'm really pleased to be joined now by RCGP Vice Chair for Professional Development, Dr Margaret Ikpoh, and Treasurer, Dr Steve Mowle. Thank you very much, both, for coming to talk to me.
Pleasure. Thank you. Thank you, Gemma, for inviting us.
So first of all, obviously, 2 days, quite a lot's been going on, and this morning we saw Wes Streeting. I mean, what did you both think about what he had to say to the conference?
We were delighted that Wes chose the RCGP annual conference to be his first speech to the profession since coming to power. And not only that, if I remember rightly, he went to see a GP surgery as his first place rather than going to a hospital as well. And he's saying that he is very much committed to investing in primary care and general practice, taking investment from the hospitals into primary care. He certainly seems to be matching his words with his actions at the moment.
I thought it was actually very, very good. So of all the objectives he gave us and, his commitments going forward, I think it's actually quite encouraging that, he realises that by putting GPs at the front and centre of the NHS, we'll be far more efficient in terms of how we provide good quality care for our patients.
Do you think he will be able to deliver on that? Because obviously successive governments and everybody has said for years we need to move funding from secondary care to primary care. I mean, do you feel hopeful that we might actually see some action on this now?
I always believe you have to keep hope alive, and that's why Steve and I do what we do. Without hope, you have nothing. And the fact that it felt that he injected a dose of realism into what he was saying, so he wasn't over-promising. And there was a question from one of our members around, we've had 18 of you before, what is going to be different this time round? And he did say, listen, I'm not going to solve this in one spending review. This is going to take a collective effort. I think he kept using the term team spirit quite a lot, actually. It's not just about me alone. I need you on board to help me do this.
I think the fact that he's listening, I think that's positive. Not every health secretary has been in listening mode, and certainly in recent years there have been health secretaries where literally we've not had a moment with them, and yet actually this health secretary is reaching out to us. Proof is in the pudding always, but of course this is going to long bake. This is a very long bake. This is a 5-10 year pudding to bake, and I think there are some early wins that he can make for our profession. I think there's always been an equity issue for UK general practitioners, and that is in the GMC register. And he did make a clear commitment today that towards a single specialist register that we would be joining. We've asked for this for decades, and actually, if the Health Secretary delivers on that promise, that will be something that will be very much welcomed throughout the profession.
Yeah, I was going to actually ask you about that. Why is that a good move for general practice, merging the registers so there's a single register?
I think it's all about parity of esteem. Often we've been looked down upon, denigrated as a profession within several spheres. It's not just secondary care, even within government. There was a period where it felt like there was media bashing going on from all angles. So I think merging us onto a single register actually was sending a message, a strong message out to others that actually we are consultants in primary care. This is what we do. We are no more or less than what everybody else is doing. And I think that would really send a strong message out, not just to the healthcare profession out there on the whole, but patients as well, who will also hear some of the bashing that has been occurring in the past.
One of the other things he talked about was this red tape challenge. I mean, do you think that's a good idea? What do you think they should sort of focus on if they're going to try and get rid of a lot of bureaucracy that GPs have to deal with?
Well, I think he mentioned a figure of 20% of everything we do is an administrative burden to us. And I would probably argue, anecdotally for me, it feels like even higher. I'm interested in the language that was used today. We're hearing words bulldozing their way through the red tape. So, that's a strong word, and it just conjure up quite strong imagery. But then to me, it suggests that actually he is being very serious about this, and getting someone like Claire Fuller to oversee that process does instill a degree of confidence in the profession, which I think will be really good. So I think the fact that we are spending far too much time on form filling, as he said, and when we can spend that time caring for our patients, there was something around digital and data interoperability as well, and I think having that single patient passport when they move between different streams in the NHS will ultimately benefit the people that we want to care for.
A lot of those sort of red tape things, I guess, are irritants to us in our day-to-day work. Every day we will get a letter from the hospital saying, saw this patient today, could you please refer them for physio, or could you please refer them for some blood tests or something? And it's like, well, you are in a hospital. Do you not have blood tests? Do you not have physios? Because that's where we think they happen. So, and it's not just time. It's that irritation of actually, we're all busy people, and we're not less busy than you are.
The media this morning picked up on that line from his speech about collective action when he called on the profession to step back from collective action. I mean, obviously, I know that the GP contract is not something that the college gets involved with. It's very much the remit of the BMA. But, I mean, what is the college's view on what Wes Streeting had to say about collective action?
So, as a college, we really do want to see an urgent resolution to the collective action. So we're still urging the government and the BMA to come to a fair outcome that will allow us to do our jobs. And in fact, for us to do our jobs, it's important because the patients need to receive the care that they so rightly deserve. But as a college, we're not a union, and it's not that we are trying to step out of the argument, but we have to remember that our ethos is to uphold, maintain, and foster the highest standards of patient care. And many of us are BMA members. Anyway, I'm still having conversations in my partnership about what we do collectively, because whatever we do ultimately will impact the care we deliver to patients. And so that's, both sides, BMA and government have to be mindful of that. And so, we take on board what he said, but we also reinforce what our chair, Camilla, has said, that please, you need to work to a workable solution that appeases both sides.
There was a question towards the end about visas for international medical graduates, and I know this is such a big issue that the college has really been lobbying on, and obviously he wasn't able to give any kind of commitment on that. But what next for the college on this? Is this something you'll continue going to really push for?
Definitely. This is something we feel really very strongly about. And I think that was probably one of our disappointments because, we realise there's a lack of funding. It's going to be a tight financial situation we're in. The GMC issue, that'll cost nothing. It'll cost a bit of legislative time, but it's not going to be a major material cost. The visa issue also is not something that will cost anything. It's about a willingness to commit to these doctors who've come to the UK to train in our system. They've committed to bringing their families. They've committed to learning the NHS way of doing things. And actually, they finished their training. They've battled through all the exams and all the obstacles that there are. And then we say, within 6 months, you've got to go now. Well, this is, to me, it should be the opposite. It should be, we want you to stay. Almost you have to stay. Because, actually we've invested UK time, energy and everything. We want you to stay. You've made the commitment. We want you to stay. And we should do absolutely everything we can do to welcome these doctors permanently into the UK.
Looking ahead, Wes Streeting mentioned the 10-year plan. It seems that we're going to be waiting quite a while to see any big changes until that plan's done. But what would you like to see as the kind of key priority in that plan from your point of view?
The number one thing is going to be the shift from secondary care to community, and probably in my heart it's around tackling health inequalities, and this is actually a big college priority because we know that health inequalities are widening, and this is such an important justice issue for us, and one gets the feeling that this government is dedicated to that. How you do it isn't simple. And actually, the Health Secretary did mention all the other ingredients around housing, education, etc. And I think that you do need to have a whole system approach to tackling health inequalities. And actually, if we can even be nudging in the right direction with that over the next 10 years, well, that'll be a great success and something that I think we would all celebrate as a profession.
I feel like I'm a broken record when I talk about this. Workforce, because without the workforce, we can't address the health inequalities we need to. And it all comes down to value. If we don't value the people in the system, they'll leave. And we have a college survey, quite a strong one, which suggests, I'm trying to remember the figure off the top of my head, but something like 2 to 3 out of 5 GPs are considering leaving the profession within the next 5 years. We are heading into a mass exodus. People might think I'm catastrophizing here, but I don't think I am. I think we really need to address the workforce as a priority.
We're Friday lunchtime-ish now, and you're both speaking in the final plenary session of the day, and your talk is called The Power of Belonging. Can you explain a bit about what you're both going to be talking about?
Yeah, sure, Emma. So this is actually a very personal story for both of us and our lives and how we came to being where we are and how we came to belonging within this national organisation, the RCGP. Importantly, it's about allyship and actually how others can support marginalised groups within our society, which we think is just an important equity issue, a justice issue that doctors should be aware of. And it's something I think we both feel passionate about.
Yeah, I wholeheartedly agree. Well, I have to because I'm doing the session with you. But it was interesting. I met a friend yesterday and we were both delegates here just before the pandemic. And she said, I can't believe that we were just running around, like headless chickens downstairs, and there you are now in the role that you're doing. And it's really because of what happened around COVID, around the George Floyd murder, that I thought, okay, we need some representation now, because I think we are in a very difficult space, but there's a willingness from the college to change and do better in terms of its representation of the members. And so it's a real personal journey that Steve and I will be talking about. We hope people will stay to the end. Typically they jump on their trains at 4 o'clock. I shouldn't say that, but I'm very much looking forward to it. And it's really just to tell people that, listen, we all belong in this space. People say, Margaret, you're the college, and I said, no, we are all the college. It's not about individuals as such, but how we can all feel a sense of belonging in the spaces we hold.
Take our council, which is our policy-making sort of senior body within the college. When I first joined council in 2007, 2/3 of council were men and only 12% from an ethnic minority. Council today is 57% women, 45% from an ethnic minority. We are pretty smack on representative of our membership, and actually our membership is probably representative of a multicultural part of the UK, say London or somewhere like that. It's actually more diverse than the general population.
That's really encouraging, and when people do praise us for that, I still tell them we do have a long way to go. Of course, we know not all protected characteristics are visible. So, but actually seeing more representation within the college hopefully will encourage others to put themselves forward for specific positions, so that we can just inspire and continue to try and remain resilient in these challenging times.
No, that's a really good message to send out to people, isn't it? Thank you both. Thank you, Margaret and Steve, for coming to talk to me. Thank you.
Thank you, Emma.
Thanks, Emma.
As I mentioned earlier, these special podcasts from the RCGP annual conference have been supported by the breast cancer awareness charity CoopaFeel, who are also one of the exhibitors here at the event. I caught up with CoopaFeel's health information manager, Emma Walker, who explains some of the work the charity is involved with. Thank you so much for coming to speak with me, Emma.
Thank you for having me.
So first off, can you explain a bit about CoopaFeel, how the charity came into being and what it is you actually do?
Of course. CoopaFeel are the UK's only youth-focused breast cancer awareness charity. We were founded in 2009 by Chris Hellenger and her twin sister Maren, after Chris was diagnosed with stage 4 breast cancer at the age of 23. Chris very sadly died this year, and CoopaFeel are committed to honouring her legacy by continuing to spread our chest-checking message. So that involves a mission. We're on a mission to get every 18 to 24-year-old checking their chest. We educate people on the signs of breast cancer, encourage them to check their chests monthly. So if they notice something unusual, they're empowered to contact their GP and advocate for themselves. And my role at the charity as health information manager involves making sure all the health information we produce is high quality, accessible, impactful, and trusted. I also play a key role in ensuring this information reaches our intended audience, and I work closely with healthcare professionals, including GPs, so they can encourage their young patients to be confident chest checkers.
You do produce a lot of information and resources. What sort of things do you have available?
As you say, we have loads of wonderful resources available, both digital and print. And important to mention, everything is free. do access all of the fantastic CoopaFeel resources. So they include things like our self-checkout web app, which is a digital tool that helps people get started with checking, a great place to signpost young patients to. We also have loads of resources. They include things like our handy wallet-sized checking cards, checking leaflets, and the very popular shower stickers, along with many more. Also reaching young people on our social channels, so Instagram, TikTok, various other channels as well. And last year we created the chest checklist videos with Black Women Rising, and that was to address the lack of black skin representation in breast cancer communications. We've collaborated with other fantastic organisations to produce patient resources. For example, we worked with Ansar Projects and Orchid to create resources for people with a learning disability. We created a series of posters for trans and non-binary people in collaboration with Outpatients, who are the UK's first charity dedicated to supporting LGBTIQ plus people affected by cancer. And our pregnancy booklet was created with the charity Tommy's as well. And you can watch all the videos, access all the resources on our website, CoopaFeel.org.
You're here at the RCGP annual conference to raise awareness of your work among GPs. Why are you doing that?
We're here to make sure all GPs know how important their interactions with young people are. Our research at CoopaFeel shows that 86% of young people currently go to or would like to go to the NHS or healthcare professionals for information on breast cancer, demonstrating the hugely important role GPs and healthcare professionals play in breast health promotion, education, and ultimately early detection.
Can you explain some of the things that you produce and how these can help GPs and others in their day-to-day work?
We have all our patient resources in healthcare packs, so they can be sent out in the post to GP surgeries for GPs and other healthcare professionals. These resources really help facilitate those checking conversations and at key moments. That could be, for example, during a pill check. Also, breast awareness e-learning modules are available for healthcare professionals. So they're on the NHS Learning Hub, also our platform Copper College, and I deliver CPD accredited webinars for healthcare professionals. All of these training opportunities are designed to build knowledge and confidence to have those breast awareness conversations with young people.
If you could say one thing to GPs listening to this about breast cancer and breast cancer awareness, what would you say the key thing they need to bear in mind is?
I would firstly say, do not dismiss a young person due to their age. In the UK, around 2,500 people under the age of 40 are diagnosed with breast cancer every year. And we all need to consider accessibility, inclusive language, relevancy and representation in our work, which will ultimately help us align with the NHS England Core 20+5 approach to health inequalities. That is what I would say. And keep supporting us and having those key conversations.
That's lovely. Thank you so much for speaking with me today, Emma. Thank you.
Thank you very much for having me.
We'll be putting details to all of the resources that Emma's mentioned there and the CoopaFeel website on the description for this episode, so you can find that if you look there. One of the things that's always really great about coming to the RCGP annual conference is that there's a lot of GP registrars and new GPs who attend the event. Dr Toyosi Adeniji is the RCGP's First5 chair, which means she represents GPs in the first 5 years of their career within the college. I spoke to Toyosi about what her role involves and some of the challenges newly qualified GPs are currently facing. So I'm delighted to be joined now by Dr Toyosi Adeniji, who is the Royal College of GP's First5 chair. Among her many roles, Toyosi is a GP partner in Northampton and her PCN's lead on healthcare inequalities. Thank you so much for talking to me, Toyosi.
Thank you so much for having me today.
First off, can you explain why the college has a First5 chair and what your role involves?
The college has got a First5 chair because we need a voice to represent our GPs in their first 5 years post-completion of training. And so I'm there to represent the views, the experiences, and also improve the college's understanding of, First5 members and their needs, really, and then providing a direct feedback. So what we have is we've also got First5 reps in different faculties, and those faculties feed up to me. And then, we have meetings, catch-up sessions, and they let me know what is happening. And essentially, I'm there to provide a strategic direction as well to the college's First5's activity, because we all need support. Regardless of where we are on this journey, we do need the support. Beyond that, thinking about leadership as well to the faculties, but also within council. I serve as a voice for our First5s within council, and obviously any other relevant meetings where decisions need to be made. I am that First5 voice in that room.
And so what sort of support does the college provide to First5 GPs? Why is it a good thing for GPs in the early years of their career to be involved with the college, do you think?
Wow, do we have enough time to cover that? The support would start from essentially thinking about transitioning. So at the point you complete your training, which is a great moment, the next step, that transitioning phase. So thinking about celebrating you. So we do have new member ceremonies, which we do for our First5s across the country. But beyond that is thinking about appraisals, for example, and how you get help with that, development in your career as well. So thinking about mentors that can actually help you along your journey, and also CPD opportunities beyond the traditional options that we have. The discounted events we've got, that's something that is on board. And recently, the one-day essentials, again, around the CPD side of things, that became free. So that becomes part of your membership, which is of great value, actually. And also thinking about communities as a whole, where you can lend your voice towards making a difference. And looking after you as well, thinking about well-being and making sure we think about your workload, mindfulness, and just make sure you're well supported in your role, regardless of what that looks like really across the country.
One of the big issues we've seen over the last year or so facing newly qualified GPs has been the jobs crisis. So there's a real shortage of GP jobs out there, and potentially those likely to be hardest hit by this are newer GPs, so the people that you were representing. Have you found that to be the case?
So sadly, that is the current reality, and it doesn't add up really, because that is not why they've trained to be GPs, to become unemployed GPs. So what we're beginning to see is some of our First5 GPs thinking of other options. So a lot of people are thinking of locums first while they explore other options. Some people are thinking of developing their interests as well in that time, whilst they, again, exploring what other roles are available for them. So it's a sad reality, but it's one that we're hoping, even as a college, we're able to help. So one of the things we've been able to do is, gather the data and, engaging with members and understanding where we're having the issues. And then now the next phase is, now signposting people to what opportunities are available in their areas. So that's the next sort of phase, really. And this is where our First5 reps would also be useful, really, in terms of helping with that.
What's your view on the government's plan to add newly qualified GPs to the additional roles reimbursement scheme?
Firstly, I would say we are pleased that, the new health secretary, Wes Streeting, is actually listening. Obviously, that whole ARRS funding, that is only a temporary solution. Beyond that, we need to sit down and see what the final details are. We understand currently it's just for a year, but we all don't know what's going to happen beyond that. But I think it's going to help. But I think beyond that, we need to think about funding general practice as a whole and thinking of the recruitment strategies, the retention strategies, and just a long-term solution beyond just using the ARRS funding. But that is a welcome start from an emergency measure perspective, really.
You mentioned retention there, and one of the other things that's obviously happened in the last year or so is we've seen the NHS England National Fellowship Programme, that's been scrapped. That was very much targeted at GPs in the first couple of years after they qualify to help them bed in, take on substantive roles in general practice. What's your view about the impact scrapping that scheme has had?
So from a college perspective, we have raised, major concerns about this loss of this national ring-fenced funding for this program. And so far, I've been hearing a lot of feedback, really, in terms of how impactful, positively, this program has been. And I think it's been a significant lost opportunity to ensure that the newly qualified GPs have the support they need to prepare them for this long-term career. So I think for me, it's what next? So for example, we have written, to NHS England about this, and because I have expressed the fact that, I think this is something we need to possibly reintroduce. And yes, they are introducing it at local levels. And I must say, I am actually a recipient of that fellowship scheme, and I can testify to the fact that it's been beautiful in terms of helping me as an individual explore my PCN opportunities within the PCN. And, at the minute, I'm PCN lead for health inequalities in my area. And it was because of this scheme. And I know a lot of other people that have similar testimonies about this, really. And for me, it was thinking beyond just my local practice, thinking about PCN. And then I was able to find the opportunity to marry up my interest. I've got a huge interest in community impact and health inequalities as a whole. So I thought, okay, what opportunities do I have? And it turned out that, there was the opportunity to build on that within my PCN, and the fellowship time allowed that to happen. So it was me finding the opportunity, but knowing I could link you up to the fellowship side of things. And the mentors from the fellowship program, that has been useful as well, really, in terms of getting mentoring from the program.
There was quite a worrying poll from the BMA earlier this year, which found that just 38% of GP registrars plan to work in UK general practice after they qualified. Do you think it's a problem that we're losing GPs very early on in their careers? And if it is a problem, what do you think needs to happen to address it?
I think it's a huge retention problem. And I think we need to have the open conversations, really, because we're clearly training amazing GPs, but other places seem to be recruiting them, better than we're doing. So we need to ask ourselves, what are they offering that we're not offering? A lot of it goes back to funding, to minimum level. We need to invest a lot more. But beyond that, it's thinking about more practical, holistic measures. And a key one that comes to mind is the fact that more of our registrars now tend to be IMGs, so international medical graduates. So we need to be thinking about what they need for their visas, for example. And it's not just the visas for them, it's their families and the cost implications for them. So if we're able to have frank discussions and actually follow up with actions around how we can practically support cohorts like that to make sure they feel truly welcomed into the system, I think we'll begin to gradually improve retention.
You're a few years into your career now. What key bits of advice would you give to a GP registrar who's coming up to the end of their training and about to transition into being an independent GP? Is there anything you would advise them to do in the first year to make that transition easier?
First thing that comes to mind is networking. And that is really key on my, in terms of advice. They need to network, engage, find out what is happening, not just with the college, but even outside the college. But beyond that, really, it's also saying, what is your why behind being a GP? I'd love them to sit down and think about that, because that then defines what their interests are moving forward, because there will be a lot of opportunities. So it's knowing, how do you then know which one you're going to say yes to? And, I know some people say, just say yes to everything. Well, you need to get to a point where you're strategic, really, in terms of what you want to achieve. So understand your why and, have your value system in place, really, because that will help guide you. And also think about what opportunities for growth are available for you, because there are always things, really, depending on your interest. I think the key thing is thinking about enjoying the journey, thinking about a work-life balance. So don't just jump into everything and anything. It's thinking about what your values are and where your family comes into that mix, really, having that clear balance, clear boundaries as well. I think that will be important, because it will be important for your well-being as well moving forward.
I think that's brilliant advice. That's really good, particularly that last one. That last one's good for anybody, whatever career they're in.
That is so true, yes.
Thank you so much, Toyosi. I really appreciate your time. Thank you.
Thank you so much for having me today.
Well, that's it for our special episodes from the RCGP annual conference. I hope you've enjoyed listening to them. Don't forget you can find all of our coverage from the event on our dedicated page on our website at GPonline.com/RCGP. I'll be back next week for our regular podcast, so please do join me then.